In this lecture, we're going to talk about connective tissue massage or myofascial release, MFR, the theory behind it and how it's carried out. I've always referred to it as myofascial release, but they are both the same thing. There are lots of forms of myofascial release and a lot of accompanying books. Many sports massage therapists will specialise in this technique, developing their own style. A commonly preferred approach is the anatomy chains theory, which looks at treating complete chains of myofascia. Myofascial release is different to other treatments you might carry out because you're targeting one specific structure. You're targeting the fascia to create change in the rest of the structures. A German physiotherapist has been credited with the development of connective tissue massage, Elisabeth Dieker. There is also reference back to Ida Rolf, who developed Rolfing, a technique which myofascial release has been said to have evolved from. This is classed as a soft tissue mobilization technique. I have mentioned the fascia on numerous occasions, and this is the structure we are trying to affect. Under the skin, you have a complete suit of superficial fascia. I think of it as a second skin. You not only have the superficial layer of fascia, which we are focusing on, it also encapsulates everything in the body, organs, bones, etc. This is the deep fascia. This is more of an holistic treatment, as we are trying to treat the whole, not specific. You will find your treatment area much broader than usual. The fascia is vasoelastic, which means it has the ability to change and remodel under certain conditions. It can be affected both positively and negatively. Things like repetitive movements, injury, and being immobile will affect it in a negative way. Massage will affect connective tissue indirectly in a positive way, and connective tissue massage or myofascial release will affect it directly, also in a positive way. The remodelling or creep happens slowly, and therefore treatment is slow, working with the tissues rather than forcing them. The change in fascia is possibly due to the ground substance becoming less viscous and collagen alignment becoming uniformed, along with collagen crosslinks being broken down. Ground substance is a gel-like substance found in most tissues within animals, within the extracellular spaces. The effects of myofascial release are realignment of the fascia, increase in range of movement, improvement in the quality of movement. Because various structures such as lymph, capillary and nerves are found in the fascia, you will also have an impact on these, increasing circulation, desensitizing oversensitive nerves and decreasing pain. Due to the nature of fascia, you may also have an impact on organ function as well. Let's now look at some of the key points to think about when delivering connective tissue massage. As I have said, there are many techniques, but we are going to keep it simple. When carrying out myofascial release, you need good contact grip on the tissues, so massage lotions and oils are out. Many people use wax, and in some rare cases, no medium at all is used, so you need good contact with minimal slip. You need to maintain an even slow pressure to push the connective tissues in the direction you want them to go. You will come up against blockages and restrictions as you work. You need to hold them until they release of their own accord. The other consideration with myofascial release is you don't necessarily work in the direction of the flow of blood as you would with normal massage. It will depend on which way the fascia or connective tissue needs to be directed. You will work down through the layers of fascia slowly, working out the restrictions or blockages at each level. Initially, you will start with broad techniques. I find relaxed forearm is often good. Knuckles work well, or flat hands. You can then become more specific if you need to, using fingers and thumbs. You can use one-directional techniques or cross-hand techniques, depending which is the most suitable technique at the time. You need to palpate well to understand what the tissues are doing and palpate between each adaptation. Make sure you are in a comfortable, sustainable position. I will talk through the techniques in the videos rather than try to describe them to you here, as it will probably make much more sense. The application of the technique is simple. Reading the body and the fascia is the harder part. I'm going to include a couple of additional techniques that aren't in your manual, which are still myofascial release, and you might find them useful. One of those would be the leg pull. You can now move on to the quiz questions associated with this section and then move on to the demonstration videos of myofascial release.